Welcome back to Picks and Politics, everybody. I'm joined now by Deputy Mayor Anne Williams-Isom. Now, she oversees New York City's Health and Human Services, which is a majority priority for the Department of Women's Health Care. So, Deputy Mayor, good to see you. Thank you so much for being here.
Of course.
We're just wrapped up Women's History Month, but we're still going because we're continuing to interview all the deputy mayors because this is a big issue for the mayor, right? Is focusing on women's health care first and foremost. How do you go about doing that? It's a big topic.
It's a big topic, and what we decided to do was we decided to bring together women from all different fields. So the tech companies, from business companies, from the community, and doctors, and we picked 4 topics to really focus on. It was chronic diseases, birth equity, sexual and reproductive health, and mental health.
Yeah.
And, you know, the idea came from the mayor himself.
Yeah.
He really wanted to focus on mental health, and mental health and women's health, and really wants New York City to be the friendliest place for women and girls and to have good health care.
So let's highlight some of the progress that's been made and where the work still needs to be done, right? What are some of the highlights?
So there's a lot of work to still be done. When you think of some of the statistics, and we really started with the data, you look at, let's see, 1 in 5 women have issues with infertility. So when we talk about reproductive, rights, we want to make sure that we're thinking about all kinds of rights and thinking about the whole life cycle. So all the way from birth to infertility to making sure that women have, pelvic floor exercises and all the things that they necessarily need, to menopause, that we don't really talk a lot about. The mayor talks about that. We looked at chronic disease, another thing that the mayor talks a lot about, because there's so much that we could do to prevent it. A lot of this is preventable, Dan. And so this idea that heart disease and cancer are the leading cause of death for women. Yeah. And so can we find ways to make sure that we are treating people's hypertension, that we are paying attention to diabetes, that we are eating right, that people have the health care that they need, and using technology and innovative ways to make sure that people have access, particularly folks in communities that don't traditionally have that kind of access and have been marginalized.
Yeah, super important there. And your department also really has a whole new issue to deal with as well, and that's these asylum seekers, these migrants that are arriving into New York City as well. Mental health is a big component of that, and it's a big task. We know there's a big issue with getting some federal dollars and local dollars to fix the problem, but how are you tackling that issue?
So again, I say to people, I'm health and human services, and I'm putting the humanity, leading with humanity. And so the issues that we're seeing for the asylum seekers are a lot around the mental health struggles that they're having, and making sure that we're connecting them to what they need in terms of getting settled. For a lot of the families, it's making sure that their children are connected to the good local schools. New Yorkers have been so fabulous with, doing bake sales and really welcoming the migrant children in the way that they need to. So this idea of health and making sure that they're vaccinated and have everything that they need, but it's super important that people get access to be able to work, because that's what people came here for, right? They came here under really bad circumstances, but they really want to be able to work so that then they can settle in the places that they need to settle.
Yeah, I don't want to put you on the spot, but I know it is budget time as well. Are you seeing any advancement in terms of getting the money you need to help with some of these issues that you speak of?
So I would say that we need definitely more.
Right.
I think the latest number is 54,000 migrants have come to New York City already. And we are doing the best that we can, but we absolutely need more help from the federal government, and we need some more help from the state government in terms of really making sure that folks have what they need in terms of housing, in terms of ability to work, and then to resettle them into the places that they ultimately want to settle to.
Absolutely. And at the end of last year, I had Mayor Adams on this very show, and we talked about this program where mentally ill New Yorkers could be taken to these treatment facilities even against their will. Right now, you are the deputy mayor of what kind of oversees this whole thing. Do you know how many people has it begun, and how many people have actually been taken against their will?
So I think this is so interesting that this is what we're focusing on, and I want to know why people don't say to me, Deputy Mayor, how many people have gotten connected to support? And how many people are really now getting what they need, whether it's a transportation to a support center or to some other place to get their support, or to a hospital because they haven't been able to. What I've seen, Dan, is that there have been so many family members that have come to us and said, thank you. I've been trying to get my family member connected to services, and that hasn't been able to happen. So what I say is that we want people to get what they need, when they need it, at the right time. And it's a very individual decision. So we have mental health professionals along with a team of people making an assessment about whether people need to go to the hospital. Right. But lots more voluntary transportations than involuntary transportations, for sure.
Now, do you take issue with the question of the number of asking how many?
Well, I think it's the wrong question to ask. I think we should say we've had this mental health crisis for a very long time, and there's many different parts of it. Are we getting people, do we have enough beds for folks? Do we have enough treatment spots? Are people, you know, do we have enough for everybody that they need? But the one thing that people want to focus on is an involuntary placement, which is very, very small and happens in not a lot of times.
I think that's the new component.
Well, I don't know that it's always been, the law has always been there. What we've done is we've given everyone who has a right to do a 941 or a 958, is what you're talking about, more information so that they can make sure that they are able to get the support that they need for folks.
It's so important, and it's an ongoing conversation. I appreciate you having it. I want to go full circle back to the top right now as we are rounding out Women's History Month, right? Because you are just one of many female deputy mayors, and it's really become a sisterhood bond. How do you all kind of operate and communicate?
So I think we were just talking about this yesterday, that I think it is important for us, because we are role models for a lot of people. A lot of us are women of color, which becomes important. But I think we take this so seriously that if we don't use this influence and power in this moment to promote a woman's agenda, to promote women's health, to make sure that we're looking at things like childcare, wage, you know, decreasing the wage gap, all of the things that, you know, good food and nutrition, all of those affect women and their communities. And so we want to use this moment to really make sure that we're highlighting those issues for working women in New York City and making sure that everybody has what they need, no matter of their zip code and how much money that they make.
Yeah, not only during Women's History Month, but every single day.
All the time.
Great to have you here, Deputy Mayor, and you're welcome back on the couch anytime, okay?
Thank you so much.
Great to have you here.